Jumuia Friends Teaching and Referral Hospital Kaimosi. This ultra-modern health facility is equipped with 100 beds, up-to-date diagnostic equipment, and a well-stocked 24-hour pharmacy. Located in Vihiga County, Western Kenya, the hospital was opened in May 2017 after extensive renovations and reconstruction of what was previously known as Kaimosi Mission Hospital. The transformation of Jumuia Friends Teaching and Referral Hospital Kaimosi commenced in 2015 after the ownership and management of the facility shifted from Friends Church of Kenya to the National Council of Churches of Kenya. This made Jumuia Friends Hospital Kaimosi the premier facility of the Jumuia Hospitals chain, which is a venture by the NCCK to provide accessible and affordable world-class healthcare to Kenyans. The idea of investing in Kenya's healthcare sector by the National Council of Churches of Kenya came about almost as an accident.
Before this venture was commenced by NCCK, my honorary treasurer then, Mr. Kibuga Kareithi, calls me and tells me his wife has been admitted. She's diagnosed with pneumonia and will be in hospital for a few days. And so after a bit of space in admission, she's discharged. And 3 months later or so, she's back to hospital. She has been diagnosed with lung cancer and is due for a very quick surgery in one of the big Nairobi hospitals.
As I walked my own personal journey, I already knew very clearly what was available in Kenya. And so when my doctors told me that the best thing for you to do is to go to India, I knew that in oncology we had certain gaps. And so I flew to India with my wife to see what, to look for an answer to her problem. Now, what was startling to me, and this is the second aspect, is that it was very clear much of the diagnostic equipment required, first of all, to identify cancer, and secondly, to treat it, did not exist in Kenya. India answered every single question.
Following Kibuga Kareithi's experience and observations of India's healthcare systems, a decision was made to visit India to at least understand why so many Kenyans were visiting that country for advanced treatment, especially for cancer-related cases, with a view of changing this narrative.
And we said we will study the Indian model and establish why is India able to offer services at a fraction of the prices in Kenya, and we shall try to reproduce it. And so we retained an Indian consultancy to ensure that we have a conversation that is robust, that is concrete, that is viable, that enables us to interrogate the Kenyan healthcare delivery against the mirror of the Indian model and determine which efficiencies of the Indian model we may be able to import.
To the church, health service delivery and healing are central to its faith. Jesus Christ, whose teaching and example Christians emulate, had a ministry that included preaching, teaching, and healing.
It's the church's mission to go to the citizens of the country and be love in action. It's very nice to talk about love and Jesus, but what do you do? We feel as a church that by providing healthcare, education, and economic empowerment, we are loving in action. And this is why Jumuia Hospitals was created, to be the first pillar that would come out to the people of Kenya as a healer.
Older mission hospitals in Africa, and for that matter Kenya, are usually part of a larger complex that includes a church, school, and hospital. Examples in Kenya include PCEA hospitals in Kikuyu, Tumu, and Chogoria, AIC Kijabe, Maua Methodist Hospital, and Friends Hospital Kaimosi, just to mention but a few. This approach to health services development was feasible when the cost of healthcare was low and significant external subsidies were readily available. Today, the situation has dramatically changed. The cost of health service provision is escalating with each passing day, thus remaining a pipe dream to the poor.
If you look at the previous church model where we did mission hospitals, these hospitals survived because they had a donor somewhere who was providing money. Now, in those days, an X-ray machine, $100,000, $200,000. It was possible for a donor to provide that. Today, a CT scan or a CT machine is $2 million, $1 million. I don't think there are very many donors who can give you a CT scan.
Therefore, the National Council of Churches of Kenya, as a family of Christian communions and organizations in fellowship and witness, decided to join her members and government in providing medical and healthcare through her subsidiary, Jumuia Hospitals Limited. The Council considered this as a social investment, which is in line with her mandate of transforming lives.
This hospital reminds us that all through the years, the church has focused on developing the whole person and has therefore sought to provide healthcare, education, economic development, and the spiritual nurture to humanity. This is the reason why Jumuia Hospital has always been special to the people of Kenya.
NCCK is on a 20 to 20-year design and plan to establish a chain of hospitals built on the principle of accessibility, superiority of care and delivery, and affordability, dotting multiple locations in Kenya at the tertiary level and primary level, with an apex of a super specialty hospital in the environs of Nairobi, where the more complicated cases can be referred to.
With this background already established, NCCK was raring to go, all under the umbrella of the Jumuia Hospitals Limited as a special purpose vehicle. The choice of Jumuia as the launching pad for the development of Jumuia Group of Hospitals transpired almost spontaneously during one of the council's meetings.
The head of the French Church, then Zablon Malenge, stands at the executive committee and says, General Secretary, I'm very happy about this plan of establishing and investing in hospitals. We have a hospital that is 100 years old and a little more in Jumuia, which is in a very sorry state. And that requires renovation and re-establishment to bring it to where you are saying you want Jumuia Hospitals to be. The French Church is willing to enter into a discussion with NCCK and make the French Hospital Jumuia your experiment for this chain. And so I offer it to NCCK, let us enter discussions. Again, there was no preparation, it just came on the floor. I listened to it, and given the promise we had made to the executive committee, it now would not make any sense to be offered a project that is already established and you don't take it so that you go and break new ground to do new hospitals.
That dream would, however, not have become a reality were it not for the timely partnership of the NCCK and the East African Development Bank, EADB.
We made a decision to focus more on the social sectors, in particular health. And in that context, we started to look around for partners that could work with us, partners that were equally interested and equally passionate about the health sector. And we came across NCCK. We found that we had a similar mission in the sense that we are keen to foster improved health services throughout the country. So that is the genesis of the partnership. It was really a meeting of minds and a confluence of ideas.
In keeping with its vision of providing globally competitive healthcare facilities and services, Jumuia Hospital Limited has since established Jumuia Friends Teaching and Referral Hospital Jumuia. Formerly Friends Hospital Jumuia, the facility has been renovated and restructured and is already functioning as a 100-bed, multi-specialty, world-class hospital with a dedicated team of medical, paramedical and support staff. Its services are enhanced and empowered even further by advanced technology and infrastructure. The salient features of the facility include 2 theaters, oncology, radiology, renal unit, and a 9-bed ICU.
I'm the only physician giving the cardiology service. I'm the only cardiologist here, because otherwise they have to go this side Eldoret or this side to Kisumu. So of course the patient, they recognize our hospital. There are a lot of cardiology patients. We have cardiology cases, a lot of cases. They come here.
Indeed, the intensive care unit at Jumuia Friends Teaching and Referral Hospital is the first of its kind in the entire western region of Kenya. It is a multidisciplinary unit where patients with medical and surgical problems are cared for.
For the past 1 year, the numbers have really increased. Yeah, I think it's because of the better facilities that we've equipped. For instance, the CT scan, we have the ECG, the echo, and the attendance has also increased. And at this area, I think we are the only hospital offering, I can say, world-class treatment to the clients around.
Huduma nimepatia huduma mzuri. Kwa sababu wakati nilikuja hapa mara ya kwanza, nilikuwa na shida ya kutembea, nikisimama kizunguzungu, sukari ilikuwa juu, pressure ilikuwa juu, damu ikakuwa chini. Lakini vile nimekuja nimepokea matibabu, sukari imerudi kwa level mzuri, pressure imerudi sawa, damu tena imerudi kwa kiwango ambayo inastahili. Sasa hata wameniandikia discharge, naona niko mzima.
As a region, we use the membership, that's the member churches, to talk about this hospital. We tell them about the services offered in the hospital, what they are able to access, and how they can access the services.
Jumuia Friends Teaching and Referral Hospital Kaimosi offers a comprehensive range of healthcare services that are so holistic in nature, aimed at addressing a variety of medical needs as follows: outpatient services, emergency care services, dental services, ophthalmology services, mother and child health services, comprehensive care clinics, physiotherapy, inpatient services, operation theaters, radiology and other diagnostic services, laboratory services, pharmacy, funeral home, and ambulance services.
When I come here, I didn't able to see the difference between the emergency patient and then the normal patient. Both are mixed. Both the emergency patient and normal patient has been mixed, and they are going to the system. So you know very well, the emergency patient might not need the care which is my normal patient need. We can delay the care which is being given to the normal patient, but it is the emergency patient we cannot delay. So we made the differentiation. We made the process flow different. If it is an emergency patient, they will go to the casualty and then the registration. Earlier, they do the registration and then only they bring the patient to the casualty. Then there is a delayed care which is not acceptable by the international community. So we cut short that delayed care. So now whenever an emergency is coming to my hospital, it will be immediately attended, number one. Number two, the patient services depends on 2 things. One is the outcome of the treatment and how much they are waiting in the system to get the treatment.
In addition, the establishment of the following highly specialized medical interventions are planned in the near future: neurology and neurosurgery, urology, plastic surgery, cardiothoracic and vascular surgery, gastroenterology, EEG, endoscopy and colonoscopy, MRI and PET-CT. With Jumuia Friends Teaching and Referral Hospital Kaimosi and Kakamega Diagnostic Center up and running, focus now shifts to Jumuia Huruma Hospital with a planned 130-bed facility, 2 operation theaters, a 10-bed ICU and radiology unit.
We are very advanced in putting up Jumuia Hospital Huruma in the eastlands of the city. Again, an area of outering that has a huge area that it is likely to serve, which is very poorly supplied with healthcare facilities and services. Jumuia Hospital Huruma will be a 130-bed hospital. We will have 2 complete theaters, 10 ICU beds, and the entire infrastructure for radiology and other support services. We are looking at opening the doors of Jumuia Hospital Huruma before the end of this year.
The rollout of Jumuia chain of hospitals is expected to follow a phased-out implementation strategy. Phase 1 includes Kakamega High-End Diagnostics, Jumuia Friends Hospital Kaimosi, Jumuia Hospital Huruma, Jumuia Bethsaida Hospital Embu, and Jumuia Hospital Limuru. Phases 2 and 3 will be developed maintaining the same pattern of establishing a secondary level hospital unit in each of the different regions of the country.
We have committed in our engagement with the Indian model to retain an Indian consultancy, build partnership with Indian hospitals delivering service, and we are in discussion with some, and we do think there will be an interface where we shall have a number of senior medical personnel coming from India and helping us set up our departments, both for highly specialized care, but even conventional treatment, including training for nurses and other personnel, so that this model we talk about is provided with a mentoring kind of setup and plan, so that our people can be encultured in a new way, in a new direction.
Interestingly, even before a number of Jumuia hospitals are fully operational, leading universities have already started eyeing the pie, thus requesting to partner with the facilities to offer training in medical and health sciences.
There are two factors which is directly proportional to the cost of the medical care delivery in Kenya. That is, number one, the manpower cost, and number two, the consumable cost. Why there is huge manpower cost is because of there is a huge gap between the demand and then the supply. It is because of this demand supply gap the manpower cost is very high. So we also want to work on to supply more based on the demand.
We have found several universities who want to work with us to start teaching in referral hospitals as part and parcel of our intervention. So for example, in Kaimosi, we are very happy to have Masinde Muliro University working with us, who will be providing adjunct professors and other consultants and interns to work in the hospital as they earn their own professional qualifications.
The National Council of Churches of Kenya and the Board of Jumuia Hospitals are alive to the fact that there is need to urgently address gaps and utilize available opportunities with a view to easing pressure on the role of government in the health sector. For instance, there is need to explore a working relationship with the National Health Insurance Fund for the recruitment of members into NHIF through churches, and also to pilot an ICU medical scheme with the insurance fund at Kaimosi.
Kusema ukweli, Friends Hospital imebadilika kwa ujenzi, kwa huduma na vile ambavyo wanapokea wagonjwa, vile ukilinganisha na hizo hospitali zingine, ukiingia hivi wanakupokea vizuri, wanakutibu na kila kitu nataka unapata. Ndio maana ukiangalia watu ambao wanafaidika hapa sana, watu ambao wako na kadi za NHIF. Hata ukikuja hapa kitu cha kwanza kuuliza, wanakuuliza kama uko na kadi.
Jumuia Hospitals have also asked the local person to enroll in National Hospital Insurance Fund, which will help them get treatment here without any problem. So we, as a community and as a person, we are saying these are the facilities that we expected.
And so our model is based on microinsurance, microfinance, and provision of financially sustainable healthcare.
The Kaimosi Hospital project is a very important project for the bank, and is actually critical to its strategy in supporting healthcare services, not just in Kenya, but in the rest of East Africa. It's the first intervention of its kind where we have partnered with a like-minded player to provide healthcare services to a large section of the population.
The message that we have for the residents of the region, and actually all of Kenya, is that NCCK, by the grace of God, has established a premier hospital facility in Vihiga County, former Western Province, that has no peer or match. It is set out for them to create accessibility of a superior healthcare delivery at an affordable cost.
So as the council rolls out her premier facility in Vihiga County, there is no doubt that the journey to medical transformation in the country has just begun and will only take alternative players like the NCCK to make a 360 turnaround of our health sector with a view of ensuring accessible, affordable and high-quality healthcare for all.